Hello and welcome to today's presentation. This is part of the National Mass Violence Victimization Resource Center's MVI SNAPS. SNAPS is a virtual educational series which is designed to provide brief, basic, skills-focused presentations about an array of different topics related to mass violence. Today's SNAP webinar focuses on how to identify a skilled and experienced trauma-focused therapist. It's designed to help crime victims and survivors, or victim services and other professionals who help them. Let's start out with the learning objectives for today's presentation. First, we're going to list factors that can influence the selection of trauma-focused mental health interventions. This is a question that comes up quite a bit. How do I know what are the best, most evidence-based interventions out there for the people that I serve? Next, we'll describe the importance of assessment. And then finally, we'll describe some different areas or questions to ask to help select a skilled trauma therapist. In the aftermath of a mass violence incident, or MVI, communities are flooded with offers of help and support. This may include individuals who say they are trauma experts in delivering therapy or counseling to victims of mass violence. These kinds of claims can be false or exaggerated or merely misguided, and that leaves communities with little guidance on how to determine whether someone has the training or expertise to provide the most effective interventions to victims and survivors after a mass violence incident. So that very first question, how do I select trauma-focused mental health interventions? Selecting these kinds of interventions can depend on several different factors. Some of them are very specific to the individual who is seeking treatment. For example, what is the victim's age? What's their cultural background? Do they have a history of exposure to other traumatic events? Do they have a history of psychological or mental health problems? It's really important to ask these questions because we know that those individuals who've experienced prior trauma or have behavioral or mental health or psychological problems are more likely to experience severe symptoms after a mass violence incident. So another important question is to pay attention to whether this is for distress that is specific to the mass violence incident. In other words, is the individual experiencing distress that's occurring right after the mass violence incident occurred? Or are these problems that are longer term? They're more persistent and perhaps more challenging to address. So in a nutshell, what I mean here is that timing is critical. In the immediate aftermath of an incident, nearly everyone is experiencing a lot of distress. However, if problems persist over time, this may warrant a very different type of intervention or services, and that can be very important in helping to determine who is going to be the best provider. It's also important to learn more about the types of problems an individual is experiencing, how severe those problems are, because both of those factors will help guide what type of provider is going to be best and what type of treatment is going to be most effective. And last but not least, what are the most effective trauma interventions to look for? For some information about trauma-focused evidence-based interventions, check out the tip sheet on our website. The link is included below. Let's take a moment to pause and reflect on what are some questions related to this webinar. Specifically, what do you look for in selecting a counselor or therapist? What do you think is the most important? Take a moment to reflect and think about these ideas. You could jot them down on a piece of paper or just think about them so that we could refer back to them later on in the presentation. Let's switch gears for a minute. A thorough assessment is really important to determine the mental or behavioral health treatment needs of MVI survivors. This should include questions to identify the types of traumatic events an individual has experienced in addition to the mass violence incident, as well as the mental and behavioral health impact of these events. This makes it really important to find out whether a provider routinely does comprehensive trauma-focused assessments before they recommend any specific intervention. Some additional questions to ask potential providers include the following. What specific measures do they administer? These measures should be those that are commonly used to get information for exposure to potentially traumatic events and trauma-related problems. Second, ask them if they score and interpret the information obtained from those assessment instruments. Third, ask if they share results of the assessment with their clients, indicating things like areas of strength, major concerns, and how they're used to inform decisions related to treatment needs. In addition to conducting this type of initial assessment to help determine an individual's needs, also check and see if the provider does any type of repeated assessment over the course of treatment as a way to monitor symptoms and make any changes to the treatment plan if needed. Another area of inquiry is the types of therapy that are provided. Keep in mind that not all treatments are created equal. This means that not all treatments are going to be effective in addressing trauma-related problems. This makes it especially important to ask providers what specific treatments they deliver. Some additional questions to ask include the following. Ask the provider, how long does this treatment typically last? How often would we meet together? How long is each session? What skills or strategies are you going to teach me that are going to be most helpful in reducing my problems related to the trauma or the MVI specifically? Is there going to be any work that I'll need to do between sessions? How do you make sure that your approach best fits individuals from different cultural backgrounds? Are family members involved in treatment? Will I have to meet in person, or can this be done through telehealth? In addition to getting information about the types of treatments that a provider delivers, questions should also be asked to learn more about their experience in doing this work. Don't hesitate to ask how many patients they've treated. Ask for details as they pertain to a particular client. For example, how much experience does this provider have in treating children, or teens, or adults, or couples, or families? We often ask these questions to help us select a physician or a surgeon for a medical procedure, but we don't think to ask the same when it comes to mental health treatments. Other questions to determine a provider's experience include, what percentage of your clients actually improve? And how do you know that they're better? Have you worked specifically with victims and survivors of mass violence or victims and survivors of other types of violent crime? If so, how many clients have you treated? Have you ever worked with clients that have experienced other types of traumatic events? Being a new therapist doesn't mean that that individual wouldn't be a great choice. However, if they are new to the field, ask whether they receive any type of supervision or consultation. And on a related note, be sure to ask about the types of training they've received to deliver trauma-focused interventions. Did they receive formal training, such as by attending a workshop? Who delivered that workshop? Did they complete some type of an online course? Did they or do they engage in any ongoing coaching or consultation from experts in trauma interventions? Did they receive any type of formal certification? Since quality of treatment is so important, be sure to find out what the provider does to ensure they continue to deliver the treatment as intended. In other words, do they engage in any formal procedures to measure their fidelity or adherence to the treatment approach? In other words, are they delivering the treatment as intended by the treatment developer? How do they know the treatment was successful? And of course, be sure to ask about their degree, where they receive their education, and whether they are actually licensed to practice. So let's check back in. How do we do? Here are those learning objectives. listing factors that can influence the selection of trauma-focused mental health interventions, describing the importance of assessment, and then finally, describing areas of inquiry for selecting a skilled trauma therapist. Take a moment to reflect back or review your notes from earlier when I asked you to think about what you look for in selecting a counselor or therapist and what you thought was important. Has this changed in any way? Was the information provided in this SNAPS webinar helpful to you? Let us know. Please provide feedback. And if you have any questions, please don't hesitate to contact us at the NMVVRC. Thank you for participating in this MVI SNAPS webinar.